Good afternoon, and thank you so much for joining us today. I'm going to give everyone just a minute to get settled. Please make sure that your phone is on mute, and we will get started shortly. Okay, we're going to get started. Thank you so much for joining us for the Mental Health and Caregiver webinar this afternoon. My name is Megan Woods, and I am the Wounded Warrior Fellow and Veteran Representative for Congresswoman Lucy McBath. I served in the Army for 4 years at Fort Hood and deployed to Kosovo as a medic back in 2014, and I joined the team in January, and I began by working with Congresswoman McBath. As a veteran myself, I understand the struggles that many of you may face, which is why the Congresswoman Adam Veal, our Deputy Communications Director, and myself decided that this webinar would be extremely valuable to our constituents during the rather unprecedented pandemic. Our goal today is to provide you and your families a source of support and resources for maintaining your mental health and caring for the ones you love, especially those suffering from Alzheimer's and dementia. Guest speakers from the Atlanta VA Medical Center and the Alzheimer's Association have graciously joined us today and will be providing a brief presentation, answering questions at the end of the webinar. It is with great honor and my distinct privilege to introduce to you Congresswoman Lucy McBath. Congresswoman, you can take it away.
Well, thank you so much, Megan, and thank you so much, Adam. And good afternoon, everyone, and thank you all so much for being with us today. And I'm so grateful for another opportunity to spend time with all of you via computer. As we know, we have really begun to depend so much more on technology to be able to communicate and to relate to one another. But I'm really excited to be with you here today, and I'm glad that we're able to stay connected during these very, very difficult times. And even as I said, even if this communication is virtual, we're still staying connected, and that's what's most important. As I have done these last several weeks, I would like to begin today's event by offering my condolences to those that have lost their lives to this public health crisis. As of Monday morning, we've lost over 1,400 Georgia residents to COVID-19. And the loss of life is just very staggering, and my prayers continue to be over our community, over the families that have lost their loved ones and are in mourning. I'm continuing to pray over America every single day over the loss of life. But we are here today to talk about two issues that are very close to my heart: mental health and our veterans. And as many of you know, I come from a military family. My father served in the Army Dental Corps, and my nephew served in the United States Marines. And my oldest brother was a chaplain. He's retired now, but he was a chaplain in the Air Force. So I'm proud to have such a strong legacy of military service in my family. And for me, protecting our veterans, both at home and abroad, has been one of my top priorities since I took office. And as a member of Congress, I have a solemn obligation to ensure that our veterans are receiving the best quality of care that this nation can provide them, especially those that are in the Atlanta metropolitan region. So where so many of our veterans actually, they choose to come here and they choose to relocate here and to transition here after they've actually served our country. In light of the ongoing pandemic, I wanted to share a very brief, subtle update on support for the Department of Veterans Affairs. The Bipartisan CARES Act, I'm sure you've all heard about this legislation, included over $19 billion in additional funding for the Department of Veterans Affairs. And I specifically helped to really push for this funding as well. This money, it actually supports increased access to our health care for all of our veterans. Nearly $600 million will go to support veterans who are at high risk to contract the virus, coronavirus. They've included additional funding for telemedicine and armed forces retirement homes. And the bill also expanded authority for the VA to help the homeless veterans and veterans who are experiencing substance abuse during this pandemic. May, if you don't know, is Mental Health Month, and this is a critical year to highlight the importance of good mental health for veterans and for civilians alike. Increased periods of social isolation, which we have right now, and our disrupted routines can really take a toll on everyone. But it can be especially hard for those that are accustomed to strict schedules and regimented lifestyles. And as a member of the Mental Health Caucus in Congress, I am working to get increased reimbursement for telehealth services by mental health providers. And I'm requesting that Congress provide funding for trauma-informed care initiatives during the COVID-19 pandemic. Ultimately, we are facing a shortage of mental health work. Developing a stronger mental health workforce is another priority that my office and I will continue to push for. We'll continue to push for greater funding in the next legislative package. But I am so thrilled to have Dr. Jennifer Smith, Psychology Program Manager for Geriatrics and Extended Care at the Atlanta VA, who's joining us today. In just a little while, Dr. Smith is going to share a presentation on her work with veterans at the Atlanta VA Medical Center and give us tips on how to maintain good mental health during the COVID-19 pandemic. Today's conversation will also highlight the needs of veterans and all senior citizens who are living with dementia or Alzheimer's. I recognize that the COVID-19 pandemic is taking a particular toll on this population, as well as their caretakers who are having to help them adjust to a new normal. That is why I am so grateful that we have Jill Disney, who is the Senior Director of Program and Services with the Georgia chapter of the Alzheimer's Association, who's also joining us today to share important support resources for our caretakers and family members of dementia and Alzheimer's patients. After our presentation today from our experts, Megan will actually moderate a question and answer session with questions that have been submitted by our attendees, many of you that are on the line. If you haven't had a chance to submit a question yet, be sure to do so in the Q&A box that you'll find on your screen. Members of my staff are actually monitoring these submissions, and we'll do our best to make sure that we get to all of your questions. And of course, any questions that we are not able to answer, as always, please continue to submit those to our office and we'll get answers to you. But right now, I'd like to hand things off to Dr. Smith for her presentation. And Dr. Smith, thank you so much, and take it away.
Thank you. It's a pleasure to be here with everybody today. I want to thank you, Representative McBath, and your team, and Adam, for hosting us and giving us the chance to talk about older veterans and mental health. Thank you for acknowledging that May is Mental Health Month. I also want to thank all of our veterans for your service. It's an honor for me to serve our veterans. I want to talk to you for a few minutes about maintaining our mental health during this COVID-19 pandemic. First, let me acknowledge that what we're going through is so strange that it has taken months for us to recognize and understand, and we still don't fully understand. The entire world is going through the same health crisis all at once. We already know this is a rare event, and if it feels strange and surreal, then remember that 7 billion people agree with you. Can I have slide 5? Many of us are sharing some additional experiences together, feeling more stress, less able to focus, maybe more tired, trouble sleeping, irritable, loneliness, grief. These are all normal reactions to this abnormal situation. I encourage you to be gentle with yourself. Allow yourself to recognize if you're having any of these experiences and remind you that you can manage your response to these things. Finding things that we can actually control in the face of a situation that feels uncontrollable can provide you with some comfort and relief. In fact, some people are also having a sense of hopefulness as well. Slide 6. Why is all this happening? These are big events, a worldwide health crisis, some stay-at-home requirements for older adults and people with certain health conditions that can be confusing, and economic hardship for people. Slide 7. So we're going to discuss today how to help yourself manage all these things and how much can actually be managed. And I really like this quote. This is one that we have shared at the hospital recently. It's not what you look at that matters, it's what you see. Henry David Thoreau. Slide 8. I think the most difficult thing to talk about is the fear that many people are living with right now. We often respond to fear by denying that it exists because we don't want it to get a tighter grip on us. Actually, if we acknowledge our fear, then we are in a position to do something, to take action. We can't deny reality, especially this reality, and starting with recognizing what we're going through is important. Just acknowledging it does not mean giving yourself over to it. It means you really know which emotions are trying to influence your actions. Slide 9. The illnesses that people were already living with are still going on right now, and you're probably accessing health care differently now than in the past. You probably have been offered or have attended a health care appointment virtually, either over video chat or by telephone. While not all services can be offered this way, many can, at least temporarily. Research tells us that high-quality care can be offered this way, and some people are finding that they prefer these virtual visits for their routine appointments. They might choose to continue with them after this pandemic has ended. And with that, I know that many people are seeing their spouses, their family members, their friends become ill or even die right now. Our society is being forced to change the way that we support and grieve with each other. Some rituals of grief might be postponed or changed entirely. I encourage you to find rituals that can still provide you with support. Simple things like looking through photographs, talking to family and friends about someone who's seriously ill or has died, lighting a candle, saying a prayer, taking some time to meditate. Reach out to those figures in your life and your community who can help as well, maybe a faith leader or a counselor. You might see on the news or on social media that people are developing creative ways to express themselves for both positive and negative events right now. You can do that too. Allow yourself to find new things. And remember that grieving for people, missed opportunities, and grieving for the things that we miss is normal. It might not be pleasant, but it is important to do this grieving. Slide 10. So what can we do that's helpful? What kinds of actions can we take to help ourselves and those around us? You can limit how much news you watch. Get information briefly and then step away. It's okay and important to give yourself a break from the news cycle. Another way that you can help yourself is to be sure that you're keeping in touch with the important people in your life. If you have the capability, then video chat or email or make a telephone call, use social media. I'm finding that some people are hesitant to reach out because they think that they might be a burden to others. The truth is that most people are looking for ways to connect and ways to help other people. So please reach out to the people in your life. If you're staying home alone right now, this is even more important. I also want to acknowledge that Mother's Day was difficult for a lot of people this past weekend because they couldn't celebrate in their usual ways. And that's just one of the many examples of things we've been asked to change or to give up. If you are staying home with other people, then practice a combination of time together and time apart. Older adults and people with some health conditions have been advised to keep themselves out of the general public for now, and you might get tired of your housemates. Keeping your sense of humor can be a really strong way to help yourself and others right now. Another practice that people are finding helpful is gratitude. At the end of each day, maybe you can find 3 things to be grateful about. Or if 3 seems like too many, then find 1. The reason this is important is because we're being overwhelmed with negative things right now, and we have to go look for the good things that are still in our lives. Bring them into focus and give them some attention as well. You might be without your usual support network right now, and if you're a caregiver, that makes things even more difficult. More information is going to be given about that in a few minutes. I would just like to encourage you to use any supports that you can, even if they aren't in your home, but they're moral support instead. Caregivers face an incredible amount of stress ordinarily, and we see many people grappling with more difficulties right now. I also want to encourage you to set some goals for yourself during this time. Small, realistic goals. I see some people are learning to speak another language or becoming really great chefs right now. I promise that is not me, and it does not have to be you either. Just managing the extra stress that we're living with can be an energy drain. Within realistic limits, set daily goals. Keep your schedule, such as getting up and going to bed at your usual times. Routines are good for us, and they help us to know what to expect in a day that might bring a lot of change. Think about any small goals you can set that help you to be the person you want to be in this world. You don't have to lose your sense of who you are right now. Slide 11. So sense of humor can really help. Here's your dad joke of the day. I think this guy might be onto something here with his antivirus mask. Taking action gives us the opportunity to find something positive in the face of this pandemic. I'm asking that you focus on yourself first, especially you caregivers, to be sure that your basic needs are met. Sleep, healthy food at regular intervals, and whatever physical movement is possible for you right now. If you're meeting your own basic needs, then you can move your attention to those close to you. I hear people say sometimes they experience the feeling of guilt when they care for themselves first. I'm not suggesting that you care only for yourself. I'm suggesting that if your basic needs aren't met, you won't be able to care for anyone else. Then you might start to think that you're failing at something, and that compounds the issue. During those times when you aren't able to take action, or you have the thought that you're failing yourself or the people around you, I'm asking you to give yourself some grace. Let's see if we can set aside the idea of success and failure right now, or at least redefine them. Make space for any struggles that you might be having, because the truth is that right now we are going to have some struggles. Give yourself a break with the expectations you probably usually have for yourself. Right now, we're all doing the best we can. All of these suggestions that I've given you are just that, suggestions. It's also okay if you can only implement one thing or even none of these things. You don't need extra pressure. Finally, I want to express my support and love for all of you participating in this event. I know you're here to learn or to find some help. We don't know when this will end, and that really adds to the difficulty that we're having. We also don't know how soon we'll be able to go back to business as usual, or if things have turned into a different kind of usual. Older adults are very experienced at change and weathering storms, and your life's wisdom makes you maybe a little better adapted to handling some of these changes we have coming. Know that help and care are available for you, even if they don't look like what you're used to. Can I have slide 12? So here are a few common questions that people are having right now, and I just wanted to give an answer to these. Staying at home for the past month has really made me anxious. Do you have any tips to help me cope? In addition to the strategies that we mentioned here, consider what is most important to you. Check in with yourself and see if you are engaging with those things. For example, if you enjoy spending time with your family and you can't do that right now, what makes that important to you? If it's sharing and receiving love and support, then see what other ways you can share and receive love and support with your family. Use technology to stay in touch, write letters. For example, at my house, in addition to talking on the phone right now, my mother and I are mailing each other little things because we enjoy that extra contact. She might mail me coupons or recipes or masks that she made. I mail her a little candy or something to do. Think about what it is that makes your activities outside the house important and see how you can still engage in that bigger underlying reason for them while you're at home. It helps you to feel connected to your life. Slide 13. If I'm feeling down and I need to talk to someone, who can I call? If you're a veteran, the VA is open for business. So if you're already assigned to a mental health provider, then do not hesitate to contact them. If you are not assigned to a mental health provider, you can get one. You just contact your primary care provider and let them know that you want to talk to somebody about how you're feeling. You can also call the VA Front Door Program. That's our main hospital number, 404-321-6111, extension 204014. If things are in a crisis, you can call the Veterans Crisis Line. That number is 1-800-273-8255, and you press 1. Can I have slide 14? If you are not a veteran, there are some national numbers you can call to find assistance, including that same crisis line. You just don't press 1. For questions about mental illness, you can call NAMI, National Association for Mental Illness, who has their support groups via telephone right now, so they're very accessible. Also, SAMHSA, Substance Abuse and Mental Health Services Administration, has information for those people who are struggling with addiction, and most 12-step meetings have moved to video or telephone formats right now. If you think that you want to find a psychologist or a counselor for yourself, you can call the State Psychological Association, or you can look at behavioral health care providers using your health insurance if you have health insurance. Those are good places to start. Slide 15. Everything I'm seeing on the news about the coronavirus is stressing me out. How can I stay updated on changes with the VA and my community without increasing my anxiety? Choose reliable sources of information that you trust and check in with them regularly, but not constantly. If something important happens at the VA or in the community, you will find out because it's going to be communicated over and over again through various channels. Allow yourself to disconnect when you need it. Take a break from social media if that helps, because sometimes people send their own anxiety out into the world and other people then pick it up. Also recognize that you might just feel some anxiety right now, and that's okay. You can feel anxious and live a good life at the same time. Slide 16. My uncle has dementia and I take care of him full time, but lately he's been very depressed. He doesn't want to watch TV or listen to music anymore. What can I do to brighten his spirits while I'm protecting his health? So there might be simple things like spending time outside, eating a favorite food. There might be physical comfort like getting enough rest, making sure that he's warm enough. It could also be a result of changes with the dementia process. So it's important to check in with their healthcare provider to see what suggestions might be made specifically for that person. Remember that if you're already having trouble understanding the environment around you because of dementia, then these circumstances are going to make things even more confusing. See if there are some ways that you might be able to change or reduce the stimulation in the environment. Also, remember to give yourself some credit and know that you are one person and you cannot control everything. The pressure that we place on ourselves as caregivers to make things perfect is really heavy. Slide 17. My family is very stressed after both me and my wife lost our jobs. We were finally able to get unemployment, but the stress is overwhelming. What can I do to help reduce the stress on my family and get back to a normal routine? This is a really stressful situation, and a lot of people are facing it right now. I certainly know people who are facing this. Allow discussion of what is happening and how people are feeling. Talking about it can be very helpful. Routines are your friend, especially when other things are very far from routine. Sticking to waking times, bedtimes, meal times, getting dressed every day, showering, and these basic things will bring something familiar into your life. Also, see if you're able to be willing to look for bright spots in these unexpected changes that have happened with your family, bringing back into focus anything that's also a positive, because positive and negative things most often go together. That can be really tough when you're facing such a heavy level of stress. It also can be really effective. So I want to say thank you and end my presentation right now, and hopefully we'll have some more time for questions in a little bit. Thanks.
Well, thank you, Dr. Smith, for that wonderful presentation, and we're so grateful for all of the work that you continue to do with our veterans. Now we will hear from Jill Disney with the Alzheimer's Association. Jill, thank you so much, and I look forward to hearing from you.
Thank you so much. It was great to hear from Dr. Smith, and thank you, Congresswoman McBath, and to all of your team. I'm so glad to be here to speak on this very important issue. Slide 19, please. I start with the mission of the Alzheimer's Association to share just a little bit about what we do and why we're a part of this topic. While Alzheimer's is the most common type of dementia, comprising 60 to 80% of all dementias, our mission is really to end all types of dementia through research, risk reduction, and by providing support to those who need us. You probably already know this, but symptoms of Alzheimer's aren't just forgetfulness, and it's not normal aging. So today I'll share a bit about the programs and resources that we have to provide that support to those who need us, especially in light of our inability to come together in person for the most part. Slide 20. The impact of this disease on Americans is really huge, and we know here in Georgia that more than 150,000 people over the age of 65 are living with Alzheimer's, and that more than 540,000 unpaid caregivers are right now caring and providing care to those individuals. Nationwide, it's estimated that nearly 500,000 veterans have Alzheimer's. This problem is huge. Right now, during the COVID-19 pandemic, those impacted by Alzheimer's and dementia are facing additional challenges. And most likely, dementia doesn't increase the risk of COVID-19, the respiratory illness caused by the new coronavirus, just like dementia doesn't increase the risk for the flu. However, dementia-related behaviors, increased age, and common health conditions that often accompany dementia may increase one's risk. For example, people with Alzheimer's disease and other dementia may forget to wash their hands or to take other recommended precautions to prevent the illness. In addition, diseases like COVID-19 and the flu may worsen the cognitive impairment due to dementia. 21. So the Alzheimer's Association is really here to provide a resource and to be a help to those who need us 24 hours a day. The 24/7 helpline is available around the clock, 365 days a year, with live individuals who answer the phone, not just a recorded message. Through this free service, specialists and master's level clinicians offer confidential support and information to people living with the disease, to their caregivers, to families, and the general public that are seeking information. You can contact the helpline day or night, and it's not just a crisis line, although we do provide that support. You can speak confidentially with master's level care consultants for decision-making support, for crisis assistance, and education on issues that families face every day. You can also contact us to learn about symptoms of Alzheimer's and other dementias. You can find local programs and services, get information about legal, financial, and care decisions, as well as treatment options for managing symptoms. We have bilingual staff who are able to assist in other languages, as well as a translation service that accommodates more than 200 languages. So really able to serve anyone who contacts us. And right now, we're hearing from family members who are seeking support for their loved ones, who are in the home with them, who may not have been previously full-time, or who are in care facilities who are now facing some new challenges. 22. In addition to the support of the Alzheimer's Association staff, many find support among others who are affected by dementia. One such online resource is All's Connected. This is an online community for caregivers and people living with dementia. You can browse through the forums without creating a profile, and this way you can learn directly from other caregivers. If you would like to post a message or a question to interact, you do have to create a profile, but it's really an online resource that's available on demand. In addition to the online community, we do encourage caregivers to find a local support group that meets their needs. The association offers several groups for caregivers that are meeting by phone and by webinar, similar to this webinar that we're having today, so while we can't get together in person. 23. Online, you can explore the Alzheimer's Association and AARP Community Resource Finder to locate dementia resources, programs, and services in your area, including your local association office here in one of the offices here in Georgia. Some of the resources that you can find there include housing options, in-home care providers, medical services, legal services, local community resources, and the programs of the association and the AARP. By calling or by contacting online, you can also find information specific to how providers are providing care at this time. 24. Another resource that we offer for those living with dementia is Live Well online resources. And these are some free interactive tools and personalized steps for living well with the disease. And this planning resource is one that I mentioned because it's been on demand and available to those who want to proactively plan after a diagnosis. And that can be found at alz.org/livewell. 25. For caregivers, you can find support and information for all stages of the disease at alz.org/care. Right now, there's a special section on caregiving and COVID-19, but there are other topics that include home safety, wandering, driving, stages and behaviors, and support for the caregiver. Some common symptoms of caregiver stress include denial, anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability, lack of concentration, and other health problems. So as you can see, it's really important not to ignore these symptoms and to take care of yourself. So important, even if it's just a brief break, to take a walk, read a book, or do something else you enjoy. 26. One of the things that we hear that a caregiver needs most is information. Information about how to be educated and empowered caregiver. The Alzheimer's Association has transitioned all of our in-person programs to virtual platforms. So they are accessible during this time when we can't get together in person. So either by webinar or by phone. And they're available free of charge, and you can find out more by giving us a call at that 24-hour helpline or by visiting alz.org/education. Some of the programs are even available on demand, so a caregiver who may have availability only certain times of night, any time of day or night, can visit and view them on demand. 27. We do also provide some of these courses live with local community educators, courses like effective communication strategies. This program is a really great one because it highlights the importance of communication with someone with dementia, particularly during difficult times such as this. As people with Alzheimer's and other dementias progress in their journey and the ability to use words is lost, families need to find new ways to connect. So this session really helps individuals explore how communication takes place when someone has Alzheimer's, so they can learn to decode the verbal and behavioral messages delivered by someone with dementia. And it helps them identify strategies to help connect and communicate at each stage of the disease. One of the benefits of the live sessions, such as this one, is that you're able to interact with the community educator, to ask your questions and to share the challenges you're having. So in addition to providing education, it is a way also to ask specific questions about your circumstance to an individual. So finding ways to take care of yourself and as well as others is so important right now. If you are able to reach out to the Alzheimer's Association, we do encourage you to do so. As I said, you can be a caregiver, an individual living with a diagnosis, or an individual in the general public who is just in need of information. So I look forward to your questions.
Well, Jill, thank you so much for your presentation. And both my offices in Washington and in Sandy Springs are very, very grateful for the wonderful partnership that we have with the Alzheimer's Association. And right now, I believe that we have some questions from our participants.
Yes, Congresswoman, thank you so much. It looks like the first question is for you. Arthur from Atlanta would like to know, he says, I need assistance to obtain military records from decades past. What's the best way to do this?
Thank you, Arthur, for that question. And I can imagine how frustrating that must be for you. Actually, my office can actually help you with contacting a federal agency to actually help you get your records. I have a dedicated team of caseworkers who work with veterans every single day to resolve cases like yours. So please give us a call. You can call my office and speak with a caseworker about your request. And the number is 470-773-6330. Once again, that number is 470-773-6330. And you can also email us at casework.mcbath@mail.house.gov if you prefer to communicate more so by email. Again, let me give that to you again. It's casework.mcbath@mail.house.gov. Thank you for the question.
Thank you, Congresswoman. Our next question is for Dr. Smith. Elizabeth from Atlanta would like to know, how should anxiety be handled during these frightful times?
Yeah, Elizabeth, I hear you. This is definitely an anxiety-invoking time. And I want to tell you there's no perfect answer for this. There's going to be some specificity to the individual, right? I think acknowledging that this is a strange time is the first thing to do, and recognizing that it's as though, if I can use a metaphor, it's as though we're all being asked to go about our daily business while a soaking wet, heavy wool blanket is laid on top of us, right? And we're supposed to still be just as effective, and we're supposed to still be just as on top of things. And that may not be possible, frankly. The burden, the psychological burden of dealing with all of this, just being out there in the world, even if everybody in your circle is okay, just knowing this is going on in the world and the idea of what might happen is really a drain on people's energy level. So really being sure that you are resting. The number one thing I could tell you to do is sleep at night. Get a night's sleep. If you're having trouble sleeping, there's a lot of excellent on the American Psychological Association website, apa.org. There's a lot of excellent material on, they call it sleep hygiene. That's the fancy term for it. And if those things are not, if you're already doing some of that stuff or you just not interested, then I would say call your primary care provider, whoever you get medical care from, and ask them if they have any specific recommendations based on you and your needs. The number one thing that you can do is sleep right now. And I think we all are, I shouldn't say all of us, many of us are having some issues with sleep right now. So I think that could help a lot.
Thank you so much, Jennifer. The next question is for Jill. A Vietnam veteran and living in memory care with advanced stage Alzheimer's. I do understand the need for quarantine, but also worry how the lack of my companionship and care is affecting his disease progression. Do you have any thoughts? Thank you.
Yes. No, thank you for that question, and thank you to your husband for his service. This has been such a difficult time, and I think we know that the burden in long-term care right now of this virus is higher than in the general population, and it's a very serious concern. So, there are precautions that are being taken to keep individuals safe right now, but that really doesn't make it any easier when you miss your loved one and when you see the disease progression really impacting him. So if visitation isn't allowed, you might want to ask the facility how you can have contact with them. I've seen a number of creative options, from window visits to sometimes courtyard visits or outdoor visits are permitted. But if not, they may be able to provide some options, including telephone or video calls. But I do agree that anything you can do to stay connected is helpful.
Thank you so much, Jill. The next question is for the Congresswoman. Mary from Roswell says, my father is a World War II veteran, and how do we protect the men and women who stepped up and served when asked, but now seem like many want to forget?
Well, thank you, Mary, for that question. I really appreciate it. And I truly believe that we should always be willing to do that, all that we can to serve those who served us and served our country. And I know how important your dad's service is to this country. We just commemorated the 75th anniversary of Victory in Europe Day, and I want to offer my personal gratitude to your father for defending our freedom during World War II. I, too, am the daughter of a veteran, and when it comes to protecting our veterans, I am very proud to support legislation that honors and protects our nation's heroes. I call them our heroes. And if your father ever needs help assessing the benefits that he's earned, my office is definitely here to help serve him. So it's my honor to represent service members, all of our district, and service members like your father in Congress.
Thank you, Congresswoman. Our next question is for Dr. Smith. Melissa from Roswell would like to know how to help boys and young men with depression.
Yeah, Melissa, thank you for that question. I think sometimes we don't necessarily spotlight boys and young men, so that's a great point. So obviously it depends on the boy or the young man. If they are not used to talking about their feelings, then it might be helpful to do an activity with them in order to facilitate that kind of conversation. Oftentimes, boys and young men will be more comfortable talking if someone is doing something alongside them, rather than a traditional sit-down, face-to-face, look each other in the eyes kind of conversation about feelings. So it might mean, I don't know if you're a mom and you're thinking about boys in your household, or if it's a broader question, it might mean that some of us have to sit down and play a video game right now in order to have a conversation, or, step outside and play basketball in the driveway. For me, I'm not very good at video games at all, but I sure am learning a lot about Animal Crossing right now. In order to facilitate those conversations. So that would be my suggestion. conversation, talking about it is really a very helpful thing to do. Not forcing any conversation, offering a lot of opportunities for the conversation to occur, and always making sure that there's that clear channel so that the other person feels comfortable coming to you and telling you what they're going through. And oftentimes for boys and young men, that kind of trust, that kind of comfort is built up through shared experiences and shared activities. So I hope that's helpful.
Yes, thank you so much, Dr. Smith. Our next question is for Jill. Donald from Marietta would like to know, what are common indicators of dementia onset?
Oh, good question. I'd say overall, it's best to look out for some changes or something that's out of the ordinary. We do offer, there's a common list of 10 warning signs of Alzheimer's, and I think that underlying them is something that's a change, something that is unusual for that individual. So I could run through the list just quickly here, but just keeping in mind it's something that's unusual, something that's out of character for that individual would be something that somebody would want to inquire with their doctor about. I will say too that it could be a dementia that has an underlying cause that's not something like Alzheimer's. So it's important to see a doctor in any case. But those 10 warning signs, memory loss that disrupts daily life, not just the normal forgetting where you put the keys, but really disruptive memory loss. The second is challenges in planning or solving problems. The third is difficulty completing familiar tasks. So someone who was always really good at balancing a checkbook, suddenly having an issue or trouble with that would be a warning sign. The fourth is confusion with time or place. The fifth, trouble understanding visual images and spatial relationships. Sixth, new problems with words in speaking and writing. 7, misplacing things and losing the ability to retrace the steps. So, not able to kind of recall after time. 8, decreased or poor judgment. 9, withdrawal from work or social activities. 10, changes in mood or personality. So any of those changes are ones that may be warning signs to be looked into.
Thank you, Jill. Those are excellent to be aware of. Our next question is for the Congresswoman. Davika from Grayson would like to know, she says, please tell government agencies they need to provide masks, hand sanitizer, and wipes for all employees on shifts.
Well, Davika, thank you for your concerns. And I assure you, I share the same concerns for good health and hygiene practices at all our government agencies. Especially in places such as the Atlanta VA Medical Center. And Megan and I we work every single day to stay in contact with the VA Medical Center to ensure that all of their employees who are taking care of our veterans are doing so as safely as they possibly can. Just this week, we learned about Secretary Wilkie. He has a 3-step plan to be able to safely reopen the VA facilities. And I will tell you that these steps really do ensure that no VA medical facility will reopen unless they meet very strict guidelines and safety requirements. So I'm always committed to making sure that Congress continues to uphold our responsibility, its responsibility to give all of our federal agencies the tools that they need to be able to serve the American people safely and effectively. So thank you for your concerns, and those are my concerns, and we are working as hard as we can to make sure that your concerns are met.
Thank you, Congresswoman. The next question is for Dr. Smith. Michael from Marietta would like to know, why does the VA deny a vet help when the medical doctors make a diagnosis of depression and PTSD?
Yeah, Michael, I see that question, and that definitely, I hear your concern there. It sounds like it could be a really specific answer, and so if it's okay with you, what I'd like is for Megan to get your information so that I can get you a specific answer at the VA, and we can make sure and have somebody or me or whoever talk to you about that, if that's all right.
Absolutely. Our office is here to help with federal agencies and assist our veterans, so we will get in touch with that veteran. Our next question is for Jill. Mark from Atlanta would like to know, what are some good ways for caregivers to cope with constant care needs in the current absence of companion care and other activities?
Well, it can certainly be tough, especially with if this is a change for someone who is now providing that around-the-clock care. Dr. Smith referred to routine being something that was really important, and I think that creating a plan or a schedule for the day, that can really help, if there is a change in routine. So kind of planning out, not necessarily planning every moment, but having some small goals to really engage in the day. So thinking about, planning those activities to engage the person with dementia throughout the day, but also thinking about how you're going to be managing your own stress. So that's really critical. So think about, how you can find those times to take a few moments for yourself, if it's physical activity, relaxation techniques, or asking for others to help. But being realistic about that, understanding, of course, that it may be hard to get more than just a few moments at a time, but making a plan for that and then feeling good about having met those goals.
Thank you, Jill. Our next question is for the Congresswoman. John from Alpharetta would like to know, what are we doing to address the issue of high death rates in senior facilities?
Well, thank you, John. I've read the stories of how COVID-19 is impacting our seniors in our community living facilities, and I've been very distressed, and my heart really breaks for those families and the loved ones of those who've lost their lives to this virus. I actually have an example. A good friend of mine, one of my best friends, her elderly mother was in a senior facility down in Florida. And because Florida at one point was closed off for people, coming into the state or leaving the state because of the pandemic, her mother she actually lost her mother to COVID-19 and was not even able to be with her mother at that time. And of course, the healthcare providers were there providing care for her, and her mother actually died alone. And so I firsthand have knowledge of how difficult this can be for those that are in our senior care facilities and don't have the love and comfort of their families with them. So I do really share your concern regarding the community spread of coronavirus in our senior care facilities. Community places of living for seniors can become incredibly dangerous if the residents become sick without proper health and no safety protocol enforcement. That's the reason why that the Georgia National Guard has been deployed to our nursing home facilities across the state to be able to monitor and assist in the state's outbreak response. Just yesterday, we learned that the National Guard has actually tested about 46% of all nursing home residents that are in the state, and they've tested about 24% of all the staff. So based on those numbers, it's really estimated that probably about another 46,000 people need to still be tested in nursing homes across the state. So I'm grateful for the continued work that our Georgia National Guard is doing on our behalf for our seniors to carry out their mission. But moving forward, I will continue to stay in close contact with Governor Kemp's office to make sure that we get a good readout and to monitor and receive all the updates that we need to make sure that our seniors are being well cared for and provided for. But thank you for that question, and thank you for your concern.
Thank you, Congresswoman. The next question is for Dr. Smith. Susan from Tucker would like to know, how are we coordinating care for veterans not in the VA healthcare?
So, hey, Susan, shout out to Tucker. I live near there. I'm not positive that I can give you the correct answer right now because there are some variables. And so if it's okay, I'd like for Megan to send your information along to us, and we can be sure and answer your question in a real thorough way. I can consult with our experts on that here at the hospital.
Absolutely. We would be happy to reach out to Susan. Thank you so much, Dr. Smith. So it looks like we have a few more questions for you, Dr. Smith. They're mostly related to the struggle with being home alone and mental health. So we'd like to continue to ask you to respond. Robert from Johns Creek, he would like to know, please provide your thoughts on how to improve the accessibility of mental health related to VA prescription refills for prescriptions that have expired and now need another doctor authorization.
So I hate to say it depends again, Robert, but it does. And I want to be sure if you have a specific question about some medications, we want to be able to help you specifically get that need met. So afterwards, I would be very happy to get an answer for you if we can also have your contact information.
Thank you, Dr. Smith. We will absolutely reach out to Robert. Shirley from Marietta would like to know, what ideas do you have to prevent social isolation with our in-a-facility seniors living and others on a constant lockdown, and seniors are required to stay in their apartments? I have seen firsthand the depression and anger at not seeing loved ones except from a window. I'm trying to think of a safe alternative, maybe a drive-through visitors area that individuals could visit outside but 6 feet apart. Do you have any other suggestions?
Yeah, Shirley, that's a great point. And I think most of us have probably seen on the news or some other media form the way that people are doing these kind of drive-throughs or things like that. My first suggestion would be to be sure that you're in good contact with the facility, whether that's assisted living, long-term care, skilled nursing, whatever kind of personal care home, anything like that. Be sure that you have a good chain of communication with them. They have some kind of a protocol that they've put into place right now. And so if you work with them, there are going to be some technicalities around how they want anything to go for the safety of all of the residents there. And so things like the drive-through visit area might be great. You know, some of these creative ideas, please call and tell them. I know people are really sharing ideas because we haven't done this before. So there are lots of good ideas that are just being suggested and people are trying them out. Go with them through a process of kind of problem solving over these things. If you have FaceTime or Google Duo or something like that, the staff might be able to facilitate these face-to-face phone calls. That can be very helpful. If somebody has a diagnosis of dementia, it might be a little confusing. It's going to be a relief to the family member who's able to see their loved one. And so the staff might be able to facilitate this. You know, you can do it simply with a smartphone, or they may have other technology available in some of the facilities. They have iPads or other things that can make this happen. But I think, you know, the face-to-face seeing somebody, if you can, is really very helpful. Also sending, you know, little gifts or packages if the facilities are receiving them. Many of the facilities are still able to accept things like food. A dear friend of mine, her mom is in an assisted living facility, and so she makes sure every week and takes by some of her mom's favorite things for her. She can't see her mom, but she does try to FaceTime with the help of the staff, and they do quarantine the items that she brings over so she doesn't take things that are too perishable. After about 24 hours is the typical quarantine that people are doing, and then they can have the items. And if you come up with anything creative, you know, if you see something done on the media or something, I would call them and ask them if there's a way to work it out. Places are really willing to work with people right now to find new solutions for this problem.
Well, thank you so much, Jennifer. We appreciate your expertise on this situation with coronavirus, and I want to thank each and every one of you for joining us today. That sums up our Q&A session. I'd like to hand it over to the Congresswoman.
Well, I want to thank our experts today. Dr. Smith, thank you so much. And Jill, thank you so much for all of your time and effort that you're spending with us today and making sure that people have their questions answered and trying to allay some of their fears and concerns. I want to thank everyone once again for taking time this afternoon to participate in our webinar and to learn more about how to support your loved ones, our veterans and our senior citizens that are suffering with dementia and Alzheimer's. It's so critical that we continue to look after one another during these very, very difficult days. And if you haven't already, I encourage you to visit our website, my website at mcbath.house.gov. As I said earlier, if your question did not get answered today, or if you didn't get to ask your question, or if you need any assistance at the federal level, please call our Sandy Springs District Office. Once again, that number is 470-773-6330. I do pray that all of you continue to stay healthy and take care of yourselves and stay safe, and God bless you all.
And that concludes our presentation.